We'd like to welcome Shiriki Kumanyika, the incoming president of the APHA. Welcome.
Thank you.
Let's start off with obesity. It's a big problem. We're seeing increased rates. Why do you think that's the case?
Well, we're seeing one positive trend. In some parts of the population, the rates of obesity are not going up like they have been over the past couple of decades. They're stabilizing and maybe even going down in some places. But there are several other aspects of what we're seeing that are of great concern. One is that rates are still going up in men. People think about women a lot, but rates are going up in men and boys. There's more of the severe obesity, so more people in the heavier end of the range. Some of the highest risk groups, which are racial ethnic minorities or low-income populations, the rates are still going up or they're not improving. And I think we also should stress that even if we were to stabilize everything now, the rates are very high. So you've got a third of the adult population, if you count conservatively, in obesity, or you've got 2/3 of the population who are actually not in the healthy weight range. And children, they're not that high, but it's the same thing. Quite a few children already have obesity or are at high risk for having it.
What public health ramifications do you think we can see in America because of the increasing rates of obesity in Americans?
Well, we're already seeing the ramifications. We're seeing diabetes, what used to be adult onset diabetes in children and adolescents, which is of great concern because that means the rest of their lives they're going to be struggling with this problem. We're seeing more diabetes in the adult population, it's just going up in parallel with the obesity rates. And these have consequences for other diseases as well. And there are more general fitness and health issues for the workforce. And so you think about, with this much overweight and obesity, the population it's not a fit workforce. Military readiness comes up, healthcare costs, all of these things, they're already in place and they're going to be hard to roll back even if we were to turn it around today. We've got a lot already in place.
So how do you think we can reconcile these numbers with the increasing numbers of children going to school hungry or living in food deserts?
Yeah, that's interesting. On the global scene, people call this a double burden, where you have some people who don't have enough to eat and some people who have too much. But the problems are linked, and in this country you have people who don't have consistent access to enough food, or the foods around them, or the ones they can afford, are the lowest quality foods. High calorie, but low quality in other respects. So we're concerned about the children who are hungry for that reason, but then the more general problem, which affects everyone, is that the kinds of foods that are heavily promoted and are available everywhere, everywhere you turn, are not the best quality foods. And they may taste good, and be easy to get, but they're not what we need to be eating. And so these problems can, those foods are easy to overeat, so these problems can coexist. And in some cases, in women, there's been evidence that the women who are food insecure are actually more likely to be overweight, maybe eating the cheapest foods and giving the better foods to their children.
So what can public health advocates do?
Well, I love talking about the solution. And this is a great meeting to figure this out because it's healthography, and what that means is making the places where you live better for your health, making choices that are good for your health easier. So there'll be a lot of sessions at this meeting about how you change the environment to make it easy to be physically active, how you change food environments. I think what advocates can do at the national level is support these big programs that help people to eat a better diet, like the SNAP program, the WIC program, the school food programs, because they get right to the highest risk populations, and also support policies that change the environment, transportation policies, and so forth.
Well, thank you for your time, Dr. Kumanyika.
Okay.